Hi, good evening all. This is Sunita. Welcome back to my presentation. Today again I back to explain some questions of previous paper. And in previous class we discussed questions of that paper, and let's we continue that paper. And I request you to subscribe to my channel. Okay, let's start the question number 31. So up to 30 we discussed. So here you can see the 31st question, what they given. Okay, so here the question is, the process of measuring services, products and practices of organization against the strongest competitors in quality control and quality assurance called. The process of measuring services and products practices of an organization against the strongest competitors in quality control and quality assurance called. What is that process? The answer is benchmarking. Okay, so I explain what is this process of benchmarking and why these organizations use this benchmarking process. Actually, most of the organization use this process. Okay, most of the organization use this process, and here you can see part A organization. Example I saying to you, part A organization, part B organization, two organizations there. Here part A organization compare to part B organization. Part A organization compared to part B organization. Why it is comparing? What is the purpose of comparing to the part B? So whether the part A giving proper services or not compared to part B organization. So part A want to know. That's why part A organization comparing to part B. Okay, in question they asked, what they asked, measuring services, the process of measuring services, products and practices of an organization against the strongest competitors in quality control and quality assurance called benchmarking. So here you will get a clear answer here. The benchmarking is a process organization used to measure and compare their services, products and against other organizations. So here nothing but part A comparing part A services comparing to part B services. Why? Because whether part A working properly or not compared to the part B. Okay, everything it will compare. Part A services compared to part B and products compared to part B, and not only that, and the part A performance also it compare to part B. Okay, whether it giving proper services, products or performance or not. And not only that, so this benchmarking is also classified into two types, that is the external benchmarking and internal benchmarking. External benchmarking is nothing but if the organization compares itself against other organization itself. If the organization compares itself to the other organization, that is called the external benchmarking. And internal benchmarking is nothing but compare one area of organization to another area of organization. Okay, if the organization, one area of organization compared to the another area of organization, that is called the internal benchmarking. Okay, sorry, I have written wrong here. So actually the external benchmarking is nothing but compare one area of organization to another area of organization, and internal benchmarking nothing but comparing itself against the organization. Okay, so here if the organization comparing itself with other department of that organization, so that is called internal benchmarking. External benchmarking is one organization is comparing to the another organization, that is called external benchmarking. Okay, the next question you can see, the nurse main priority assignment while caring for a client having spontaneous abortion. When the client has spontaneous abortion, we can see so many complications and so many symptoms also we can see. The woman who went for this spontaneous abortion. See here, so in that situation, we can see dehydration, hypertension, subinvolution. So these symptoms we can see along with the hemorrhage. So among these symptoms, priority assessment when we have to do while caring the woman with spontaneous abortion. So priority assessment we should do in case of hemorrhage. Okay, so how much bleeding the woman has, how much of amount the women losing blood, everything we need to check. Okay, so later we can give the treatment for dehydration, hypertension, each and everything, but the priority we have to give, we have to check priority assessment. What we have to do first, we have to check the level of hemorrhage. Okay, next question here, 23-year-old. So case you can see here, 23-year-old Mega comes to the hospital because the problem, she has missed menstrual period. Okay, then she has hypothyroidism, and for that hypothyroidism she has been taking thyroxine medication, and not only that, she also has the artificial heart valve, and for that she is taking warfarin or comedone. And not only that, and she recently started one more medication, that is tetracycline for acne, and she also has a human chorionic gonadotrophin test positive. Here they asked that which of the following medication should be patient continue to take during pregnancy. Nothing but these many medications she is taking. Here now she has positive, now she is pregnant. So is there any problem if she is taking these all the medication? So that's why they asked here, which of the following medication should the patient continue to take during pregnancy? And the answer is thyroxine, and nothing but hypothyroidism medications she can take during pregnancy also, but these medications like warfarin or tetracycline, okay, so these she should not take during pregnancy. Why? Because it causes some complications. Like you can see, if she continue this medication warfarin or tetracycline during pregnancy, it causes some birth defects to the fetus, and it also harms the baby. So that's why she should not continue these medications like tetracycline and warfarin. The next question you can see, vaccines and toxide produce. Vaccines and toxide produce which type of immunity? Active immunity. And in previous class also we have discussed types of immunity. Here you can see types of immunity. How many types of immunity? Innate immunity and acquired immunity. Acquired immunity again divided into two types, active immunity and passive immunity. Active immunity again it is divided into natural, artificial, and passive also divided into natural and artificial. The best example of this natural active immunity is through infection. So whatever infection whatever immunity we are getting, immunity power we are getting after infection, so that is called natural active. And the immunity power if you are getting through the vaccines, that called artificial active. The next one, if you are getting immunity power by the mother, so that is passive natural, or from other sources, so that is called passive, nothing but antibodies, from antibodies of other animals, so that you can call passive artificial. The next question you can see, best and safest method of sterilization, autoclaving. Okay, autoclaving is the best and safest method of sterilization. Here you can see autoclaving is a process of sterilization, and it kills the bacteria as well as eggs. Spores is nothing but eggs of a bacteria. And here auto is nothing but self, and claving is nothing but self locking device. By locking all the articles inside, they locking all the devices inside, and it sterilize all the articles. The next and here one more term you can see, PSI. Okay, the abbreviation for this PSI is pounds of pressure per square inch. Okay, then next, so how much temperature how much temperature we should use for autoclave is 121 degree Celsius. Okay, the next question you can see, next, sunken fontanelle is sign of, sunken fontanelle is a sign of dehydration. Okay, the next question, delusions are common in depression. Delusions are common in depression, except nothing but in depression the persons also has a delusion, and we know the so many types of delusions are there, and in the depression person we can see different types of delusion. So one delusion is not present in depression client. What is the delusion? Delusion of grandeur. Delusion of grandeur is not present in the people who has the depression. And what type of delusions we can see? Delusion of poverty, delusion of persecution, delusion of delusion of nihilism also we can see. But delusion of grandeur is not present in the depression client. The next one, next question, 14 principles of management was defined by. 14 principles of management was defined by. The answer is Henry Fayol. And what principles he has given here, you can see. So here he given the principles like 14 principles. One is division of work, authority and responsibility, discipline, unity of command, unity of direction, subordination of individual, remuneration, centralization, scalar chain, order, equity, stability, initiative, script D crops. Okay, so these 14 principles given by the Henry Fayol. The next question, use precise method to investigate problems and arrive at solutions called. Which of the following is used to prescribe method of to investigate a problem and arrive at solution called scientific problem solving. Scientific problem solving. Nothing but here what we are doing? We are doing investigation to find out a problem, and not only that, after finding the problem again we are doing investigation for that problem to get the solution, and using precise method. Few method we are using. Okay, so that you can call the scientific problem solving method. Okay, next question you can see, oligohydramnios. Oligohydramnios associated with which of the following condition? Nothing but what is the cause of oligohydramnios is nothing but low amniotic fluid. More amniotic fluid is called polyhydramnios. Okay, what is the cause of? Okay, what is the cause of oligohydramnios? The answer is renal agenesis. Renal agenesis. Renal agenesis is nothing but here fetal kidney failed to develop. So this is a congenital abnormality. Okay, renal agenesis is a congenital abnormality in which the fetal kidney failed to develop the urine. Okay, so actually what is the amniotic fluid? Where this amniotic fluid produce? What is the source of getting amniotic fluid in the womb? Is nothing but, so from the urine. Okay, from the urine of a fetal make the amniotic fluid. Okay, but here the fetal kidney not generating, here kidney failure is there. So because of that the fetus not generating proper urine. So failure of urine formation stops the amniotic fluid development in the womb. So this is one cause. Renal agenesis is a cause for the oligohydramnios. Okay, then next, how audit differ from research? How audit differ from research? And the answer is, it does not need as many people to collect the information, but research need the people to collect the information. Why? Because without sample we can't do the research, right? Okay, so compulsory the sample is needed, the people are needed, but for the audit doesn't need people to collect the information. The next, The genetic material DNA contained in, so where the DNA present? The DNA present in the nucleus. Okay, so full form of the DNA, deoxyribonucleic acid. Then motilin is secreted by, ileum. Okay, intestine, the part of intestine, ileum. The next motilin, here you can see. Okay, so motilin is a hormone, so it is secreted or released by the small intestine, ileum part, and the function of this motilin is stimulate the gastric, and it is also stimulate the small intestine motility. And so what is the main function? Not only that, main other function of this motilin is it moves the undigested food from small intestine to large intestine. Okay, the next most serious complication of meningitis in young children is, the answer is communicating hydrocephalus. Actually the CS develop if the CS develops outside the ventricles, so that we can call the communicating hydrocephalus. Okay, then next question, calorie intake of 1 year old child. How much the child has? The child should take calories. The answer is 1000 kilocalories per day. The next one, the full form of ACTH, adenocorticotropic hormone. And this hormone secreted from the anterior pituitary, and the purpose of this ACTH hormone is stimulate the adrenal gland of the kidney, and it releases the cortisol. And what is the purpose of this cortisol? It relieves the stress. Okay, when we expose to the stress, it stimulates the anterior pituitary, and anterior pituitary releases the ACTH, and ACTH stimulates the adrenal, and adrenal gland secretes the cortisol, and then automatically it relieves the stress. Then okay, acid medium of vagina maintained by, Doderlines bacilli. Okay, next OSCE means objective structure clinical examination. So this is one of the evaluation method, and in this evaluation method, so they used to check the student clinical skills and ability of students and healthcare professionals. And in this OSCE method, they check communication skills of student, history taking, how the students taking history, and physical examination skills, and not only that, clinical reasoning skills, and whether they have the knowledge or not in the medical, and how they are handling patient. So these all skills are they used to check by using this OSCE method. The next question, visceral pleura is the membrane lining the surface of the lung, and we know that the lung covered by two layers, that is outer layer we can call parietal pleura, and inner layer called visceral pleura. Okay, and here you can see the purpose of visceral pleura is protect the lung, and it is also protect from the infection, and it is also decrease the pneumothorax risk, and it is also produce the pleural fluid, and pleural fluid lubricate this outer layer and inner layer. The next one, the characteristic of an ideal normal distribution curve is which shape? Normal distribution curve, the shape is bell shape. Okay, here you can see the structure of a normal distribution curve. Thank you all, and if you like my content, please subscribe to my channel.